Hello and welcome to another talk brought to you by Physical Therapy Continuing-Education.org. On the phone today I have David Butler. David is a physiotherapist with a graduate diploma in advanced manipulative therapy, has a master's degree in research and a doctorate in education. David is internationally renowned clinical educator and pain scientist and the director of the Neuro-Orthopedic Institute. David is an author. Some of his works include Mobilization of the Nervous System, The Sensitive Nervous System, and Explain Pain. On top of all that, David is an adjunct lecturer at the University of South Australia, as well as a regular keynote speaker at clinical conferences around the globe. David, welcome to the call. How are you doing today?
Yeah, good, Sasha. Nice to hear from you.
Yeah, well, it's fantastic to have you on the phone here. Wanted to talk to you about your work, but before we jump into that, just wondering if you could tell us a little bit about your background. You certainly have an interesting combination of degrees. So if you could talk a little bit about that and how you developed your interest in neuroscience and neurodynamics.
Yeah, thanks, Sasha. I graduated at the University of Queensland and moved to South Australia and was lucky enough to study my first degree in the final days when Jeff Maitland was teaching down here. So I got a graduate diploma in advanced manip therapy. That was some time ago, 1985. And after that, I got a master's. I was always interested in the measurement of pain. And then I realized maybe 6-7 years ago that I needed something different. So I left the physio world and I went into the world of education and did a doctorate in education. And that was particularly looking at how physical therapists think and how biomedical they are, how biopsychosocial they are. And but on the way, I got trapped because 25, 30 years ago, Jeff Maitland and Bob Elvey were using the upper limb tension test and the slump test. And suddenly, in the world of manual therapy, we had hold of the nervous system. And as an old teacher of mine once said, young Butler, if you've got hold of the nervous system like that, it's like getting a tiger by the tail. You'll never know where you'll end up. And it's been quite a journey from the nerves up to the brain. And I'm not sure where the next step is.
Well, just mentioning two of those key people there in kind of the neurodynamic world of Jeffrey Maitland and Robert Elvey, could you just give us a little bit of kind of the history of when therapists and why therapists started looking at the nervous system?
Yeah, that's in the manual sense, of course. For many years, the joint and the muscle reigned supreme, and I guess it was Jeff Maitland who really kicked things along. And there's a lot of good stuff in his approach. There's a lot of things we don't agree with these days, but one of the key things old Jeff used to say was make features fit. When you talk to a patient, try and make sense of it. And he would always do that. And things like if a patient said it hurt their back getting into a car, Jeff would look at it and think, well, the head is down and the leg is up. What's going on here? And, of course, that's part of what started off this the science of neurodynamics. And I really love it because it's a science that started from the clinic. And I think that's a really critical thing in Western thinking, that ideas drive data, not necessarily data driving ideas. And I really think that the clinicians out there should stand up and be heard a lot more.
Right. And then Robert Elvey, could you just talk a little bit about his...
Bob's work, he's over in West Australia. Bob's retired now, but he was the one who really started the work on the upper limb tension test, or upper limb neurodynamic test as we now call it. And Bob started off with a series of cadaver dissections and started teaching, and he's a true pioneer in this area. I was lucky enough to stand on the shoulders of a few giants and perhaps take it a bit further.
Yeah, fantastic. Well, let's talk a little bit more specifically there about the mobilization of the nervous system. I guess what are some of the key points that you would like therapists to know about that?
I think there's a few there. I think it's a topic which is still missed, and the fact that the nervous system has enormous physical abilities, and that it's a continuum right through the system. And you know, despite the fact that we've been teaching for some time, I still think out there very few people would realise that, for example, most plantar fasciitis or heel spur pains, if you put someone in a slump position, that is, tighten up the whole system, the movement of the head will actually evoke pains in the feet or the calves of a significant number, not all, of these patients. So there's a continuum of the system. And you know, I think there's an anatomy there that's still not taught. So, for example, if you flex your head forward, you're significantly moving the dura, the spinal cord and nerve roots in the lumbar spine, and even down into the into the hamstrings. So there's quite a continuum there. And there's another critical thing, and this is where the world of neurodynamics is linking into modern neurobiology and modern pain sciences, and that is that a pain mechanism has a physical dimension to it. And what I mean by that is, if you think someone has a peripheral neurogenic pain mechanism, so that is, there's processes in the peripheral nerve, that will nearly always be linked to some sort of physical issue, like the nerve not moving properly, sliding properly, or unable to handle compression from structure around. The mechanism has a physicality. Even in somebody with a chronic pain state where there might be changes in the spinal cord or even up to the brainstem, there's often a physicality to that too. Like the meninges have to move, the cerebrospinal fluid has to move, and I still think it's sort of forgotten that this incredible conduction that the nervous system does has to be carried out on a system that is physically competent.
Great stuff. And then finally, if someone was interested in finding out more about your continuing education courses held by the Neuro-Orthopedic Institute, how would they find out more?
Yeah, they can go to our website, www.neugroup.com. That's NOIGROUP.com. Our company runs, we're not a big company, but we probably run about 100 seminars a year in the world, I guess, and the seminars vary from the neurodynamic work and then up to the explained pain courses, and also the graded motor imagery courses we are now bringing in. From the US, we certainly have a dedicated faculty there. We've got 5-6 teachers in the US. The main site where people can read about it, read the course statements, read the CVs about any instructor, is www.neugroup.com.
Perfect, and I'll be sure to include a link to that as well. David, I'd like to thank you for your time. I appreciate you coming on the call with me today and sharing your insight and expertise in this fascinating area of therapy.
Good on you, Sasha. It's lovely to talk to you, particularly an Aussie over in America. Yeah. And
thank you for listening. For more great interviews, please visit us at physicaltherapycontinuingeducation.org. That's physicaltherapycontinuingeducation.org.